Today we're going to be injecting an intramuscular injection, and so what we need here is a luer lock syringe, and you see that this cap here twists on and off. So that's what it means to be luer lock. You have a 23 gauge needle that is 1 inch long, because you need the 1 inch long for it to be intramuscular. And you have gauze to stop bleeding, alcohol to clean the area, a band-aid, and obviously gloves. So now, last time on YouTube I got reprimanded for having an exposed buttock, so we're going to do this clothed, even though obviously it's non-ideal for medical teaching. And so here, just grab the camera there. And you can divide the buttock into 4 quadrants. Now, whether you want to do it this way or this way is fine, but either way, right around here, you have the area where there's muscle that you can inject safely. Okay, so and now if you can just pan over, you'll notice that the medicine we're injecting, and it doesn't matter what the medicine is not actually, come follow me, is not situated on the tray, because this is where blood is happening, so the medicine to be drawn up is away from the tray. Now, of course, we have to draw up the medicine, so I take the cap off. Have to wipe the top. This is just from another video. Okay, and you draw up your medicine. And of course, you make sure that the medicine is not expired, and it's not, and you make sure that, you know, it's the medicine that you intended it to be, so that's great. Okay, so, okay, so please start reading.
The same needle that drew up the medicine can be used to inject the patient. For injections into the deltoid, wipe the injection site. For injections into the buttock, use the superior lateral aspect of the gluteus maximus. Pinch, squeeze the area to be injected.
Okay, so now I'm going to expose just the area to, no, this is enough. Okay, so this was the upper outer quadrant right here. So, well, first we've got to swab the area. Okay, very good. And now, with my left hand, I'm pinching and squeezing the area. Okay.
So that the muscle, fat, and skin are between your fingers. Warn the patient of a pinch.
Pinch.
Then immediately pierce the skin,
okay,
holding the syringe between your right thumb index and entering the skin perpendicular.
You see, I'm perpendicular, so can you look at it more from a perpendicular? Okay, and I'm holding it with my right thumb index, and in it goes, all the way down to the base. Okay, and now, okay.
Let go of the skin pinch with your left thumb index.
Okay.
Transfer the left thumb index to the syringe, thereby freeing up your right hand. Slide your right thumb up the syringe until it rests on the top of the base of the syringe.
So this is my right thumb, and it's going here, okay?
Place your right index and third fingertips on the underside of the syringe plunger.
You see that?
Without displacing the syringe or the needle.
Wait 1 second. You can step back a little bit, but you have to see my 2 fingers on this part of the syringe and my thumb on this part. So the idea is that you can see me pulling it up in the opposite direction, okay?
Without displacing...
We'll go around.
Without displacing...
Wait 1 second, sorry. Sorry. It's fine. Okay.
Without displacing the syringe or needle, pull up the syringe with the right index third.
Okay, so check it out. My hand and my fingers are holding the syringe steady to her body. So now my right hand can work without moving the syringe. Okay, and I'm pulling up, and I see that there's no blood. Okay, so that's good.
While giving assistance with the thumb via partial extension of the right thumb PIP joint. Observe the syringe for a flash of blood. If there is no flash, it is safe to inject.
Okay.
If there is a flash, withdraw the needle and apply pressure to the area. Choose another area to make the injection. When it is safe to inject, move your right index third fingertips to underneath the base of the syringe, and move your thumb to the plunger.
So I was here, and then I just switch, okay?
Continue to stabilize the syringe with your left thumb index. Inject the medication at a reasonable pace.
Inject. It's going to burn a little bit. Sorry.
Not too slowly, as it may burn or hurt as the medicine goes in. But not too quickly, in case you need to stop for some reason. Withdraw the needle.
Okay, so I let go, I withdraw the needle.
Activate the safety mechanism.
If there were a safety mechanism, I would activate it here. So you have a choice of just leaving it on the tray, or if you want to try to kind of at the very least, cover the needle, but with one hand. Okay.
Then apply pressure to prevent any possible bleeding.
So you see there's blood there at the injection site, so I have to put pressure there. Okay.
Dispose of the sharp and apply a Band-Aid.
Right, so and whether you do which one first doesn't matter. Here I am going to just finish and apply the Band-Aid. Sometimes it's hard to see where you stuck the patient, but it's okay. Here we put the Band-Aid, now she is ready, and here we dispose of the sharp, and we're done.
Okay.